Will you believe if we said one of the leading causes of death in the world is choking? As you just saw, this can happen to anyone, anywhere, simply while enjoying a meal. Choking occurs when a foreign object is lodged in the throat or windpipe, blocking the flow of air. In adults, a piece of food is often the culprit. Young children often swallow small objects. Because choking cuts off oxygen to the brain, administering first aid as quickly as possible is a must. It is important to quickly assess when a person is choking. How do you do that? If you have ever noticed a victim choking, you would have seen the victim clutching his or her hands to the throat with one hand and trying to reach out to somebody with the other. This is called the universal sign of choking. The other symptoms of a person suffering from choking include inability to talk, difficulty in breathing, noisy breathing, inability to cough forcefully, skin, lips and nails turning blue or dusky, and sometimes even loss of consciousness. If you were to find anybody suddenly choking, what should you do as a first responder? In extreme cases, it's better to call an ambulance. While waiting for the ambulance, perform Heimlich maneuver on the victim. Giving a benefit of doubt, the particle may not have gone deep inside. This can be easily dislodged by giving back blows. In case this is not effective, or you know that the particle has got stuck deep inside, perform Heimlich maneuver. Heimlich maneuver is an emergency first aid procedure for dislodging an obstruction from a person's windpipe in which a sudden strong pressure is applied on the abdomen between the navel and the rib cage. Now, let us see how to give back blows and perform a Heimlich maneuver.
Heimlich maneuver. For giving back blows, stand next to the victim and make the victim bend forward slightly. Place your left arm in the chest area of the victim to give support. Give firm blows below the shoulder blades of the victim. This would help in dislodging the particle if it is stuck in the top of the passageway. To perform the Heimlich maneuver on someone else, stand behind the person. Place your feet between the victim's feet. With your hands, lift the victim's armpits slightly and wrap your arms around his or her waist. Tip the person forward slightly. Make a fist with one hand and position it slightly above the person's navel. Locate the V point on the chest and move your fingers 2 inches towards the feet. Grasp the fist with the other hand and press the abdomen hard with quick inward and upward thrusts as if trying to lift the person up. Continue to do this until the victim is induced to cough and the blockage is removed or the victim becomes unconscious. If the victim is taller than you, make the victim sit on a chair and perform the same procedure.
It could happen that you are all alone and you are choking. When there's no help around, you can perform Heimlich maneuver on yourself. Place your fist slightly above your navel. Grasp your fist with the other hand and bend over a hard surface, preferably a chair or a countertop. Then push your fist inward and upward. Repeat until you are induced to cough or feel like puking, or the particle or other blockage is dislodged.
Choking in obese or pregnant person.
If the choking victim happens to be an obese person or a pregnant woman, providing the Heimlich maneuver in the abdomen will cause the damage to the infant in the pregnant lady, and for the obese person, the fat layer will not allow us to reach the abdomen. To be effective in such a situation, position your hands a little bit higher than the normal Heimlich maneuver at the base of the breastbone, just above the joining of the lowest ribs. Press hard into the chest with a quick thrust. This is called chest thrust. Repeat until the food or other blockage is dislodged by inducing the person to cough or until the person becomes unconscious. Now, what if an infant is choking? Let us look at how to provide first aid if the victim is an infant.
Infant choking. To clear the airway of a choking infant younger than age 1, you need to be in a seated position. Using your index and middle fingers, lift the chin of the infant while your palm rests on the infant's chest. Next, turn the infant face down on your forearm and hold the infant resting on your thigh. Next, thump the infant gently but firmly 5 times on the middle of the back using the heel of your hand. The combination of gravity and the back blows should release the blocking object. If this doesn't work and if the baby is not breathing, then hold the infant face up on your forearm with the head lower than the trunk. You should then place 2 fingers at the center of the infant's breastbone and give 5 quick chest compressions. If the breathing doesn't resume, repeat the back blows and chest compressions. If you are unable to help the victim immediately, call for emergency medical help. If either one of the techniques opens the airway but the infant doesn't resume breathing, begin infant CPR.
Like in all other situations, there are a few things we should not do during choking. It is common practice to immediately rush to offer some water or any other liquid to drink when a person is choking. It is advisable to avoid doing that because the object more often is stuck right in between the food pipe and the windpipe. When any liquid is thrust down that path, there is every chance that the object could get pushed into the windpipe. This would further complicate the situation. Hence, performing Heimlich maneuver is a safer bet where the victim is infused to cough so that he or she would spit it out. As you perform Heimlich maneuver, simply because the choked particle is obstructing oxygen to get into the system, the person can black out and become unconscious. In such a scenario, you need to first lower the person on his or her back onto the floor to clear the airway. If the object remains lodged and the person doesn't respond after you take the measures already stated, make sure to start the BLS, basic life support, immediately, and if needed, start the hands-only CPR to supply oxygenated blood to the brain.
Chapter Summary.
In this chapter, you have learnt the universal sign of choking, back blows, the Heimlich maneuver with abdominal thrusts, abdominal thrust on yourself, chest thrusts for obese persons and pregnant women. What to do if the victim becomes unconscious during Heimlich maneuver?